Hello, everybody. My name is Ansley King, and I will be presenting on opioid use in pregnant women. So, what are opioids? Opioids are a class of drug that comes in many forms. It can be prescribed as a pain reliever, such as Oxycontin, as well as can be found in the street, such as heroin. Opioids are used to block pain signals between the brain and the body and are typically prescribed to treat moderate to severe pain. In addition to controlling pain, opioids can make some people feel relaxed, happy, or high and can be addictive. Regular use of these prescribed drugs can increase your tolerance and dependence, requiring higher and more frequent dosages. In addition, opioids can restrict your ability to breathe, and when taken at a higher dose and misused, can lead to a fatal overdose. So as you can see here, opioid use has quadrupled in the last 10 years and continues to grow. Opioids are still the #1 prescribed drug for pain relief, and in many cases can lead to addiction. So how do opioids affect pregnancy? If opioids are used during pregnancy, the child will most likely develop a disease known as neonatal abstinence syndrome, or NAS. NAS is a result of a baby born addicted to opioids and is suffering from withdrawal. This coincides with a multitude of conditions such as seizures, sleep deprivation, intellectual disabilities, tremors, and more. In the United States, reported rates of neonatal abstinence syndrome increased from 1.5 per 1,000 to 6 per 1,000 live births over the course of 10 years. So for most women who become pregnant while using opioids, detoxification is not considered a safe option because this increases the risk of miscarriage. The leading treatment for women with opioid use disorder is called MAT, or medication-assisted therapy. MAT includes medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. This should be the very first approach when treating people with opioid use disorder. Methadone and buprenorphine are considered safe to use for treatment of opioid use disorder in pregnant women. Methadone requires nearly daily visits to a dispensing clinic, whereas the dosages of buprenorphine requires a person to be in active withdrawal at initiation and can take multiple days to complete. Polydrug use is the main issue when determining treatment. Treatment can be very generalized when it comes to drug use. There are different approaches for tobacco, methamphetamine, alcohol, opioids, etc. And if someone is using multiple different drugs, it may be hard to encompass them all and isolate certain effects. So my discussion questions are, how would you analyze different healthcare providers' approach to opioid use disorder among pregnant women, such as Medicaid versus private insurance? My second one is, if there are still growing numbers of opioid use and overdose, why are they still being prescribed to patients at such a high rate? These are my references, and thank you for watching.